my name is Keeler, and I am the scribe manager for Emergency Care Consultants. And here is our headquarters, right in the heart of Prospect Park. A typical day for me in the office is I come in right at 7 a.m. and usually I am checking on emails, seeing if there's any big updates or things going on. Depending on the day, I will have anywhere from 3 to 6 interviews for interested applicants. There's also days where I am approving scribe time for payroll, as well as planning for new hires. So planning for upcoming orientations or a full day of orientation to help our scribes prepare for their upcoming training shifts.
How I got to the position that I am. I started off as a scribe for a emergency care consultant as an undergrad. I was initially pre-med and wanted to go to med school. I had different leadership opportunities through ECC, including our scheduler. I was a lead scribe for one of the clinics that we have. And I started to change my gears a little bit and wanted to go more into healthcare administration rather than clinical medicine. And then I was approached by our company a little bit to ask if I was interested in a position, and I actually started as scribe coordinator for about a year, and then ultimately was promoted about 6 months ago to scribe manager.
Behind us, or in front of me, I guess, is Prospect Park, right in that front of that light rail stop. And then behind us, we actually get that opportunity to oversee University Park Village, as well as the campus. I get to see Twins TCF Bank Stadium every day, which just great memories there as well. And then also to Moose Tower. I spent a lot of time there with my classes of different science classes or health classes too. So it's really fun to be able to look out my window every day and see the campus that I went to school at. How's this for hand placement?
Pretty good. I mean, I'm helping you out.
Okay, good.
I was always interested in healthcare. How I landed on the physiology major in the College of Liberal Arts, I liked the idea of the liberal arts college where you get a well-rounded education. You kind of get to see all different fields. And the physiology major I landed on because I liked the flexibility that major offered, as well as it was more geared to humans. If I was interested in human healthcare, the physiology definitely was geared more towards that and had a lot of flexibility within the major in terms of electives, timelines. I think it was really geared towards pre-medical students, and I really enjoyed it.
To study healthcare as well as then work in healthcare in both in the same environment is a very unique opportunity, I think, because I get to learn it and then later on I get to go practice it right from where I learned it, especially here where I'm, a few blocks from where I actually learned all of my information and be able to apply it. I think working in the metropolitan area in healthcare, you see a ton of different cases. You get that opportunity to see a lot of different patient populations, which just gives you that different learning experience, as well as to see how different patients have it within the Twin Cities, even though they all live within the same 50-mile proximity.
I think healthcare, it takes a specific kind of person to go into healthcare. You definitely need to be able to communicate with all sorts of people. In any job, I think communication is a really big skill. With healthcare, it's really important because you need to be able to communicate with your patients or coworkers, and everyone is different. Everyone comes from a different background. And CLA, I had the chance to take a second language, and I chose American Sign Language, which was unique. And so I was able to see that different community, not where it's still kind of based on English, but that side of a second language, and the different classes that you take, because a lot of your general lib eds that I would think that I took would have had all sorts of different majors that I was in. Came across people with science backgrounds, maybe more communication backgrounds, and so I think you get to base a lot of that because you get to work alongside many different backgrounds in the College of Liberal Arts. I also minored in public health, and I think those type of classes too helped give me to healthcare and just see that wider spectrum and not just narrow it in and focused. It just kind of gives you a big background pieces where you can go in different options, especially for me where I started pre-med, was wanting to go to med school and changed gears to the background piece of healthcare and wanting to do that portion instead. Nearing the end of my undergrad, I actually had a lot of stress. I was working as a scribe, and I initially was going to take my MCAT to go off to medical school or apply that cycle right after graduation. And it started to really build up the anxiety of, I have these last classes to take that I need to pass in order to graduate on time. I'm working in order to maintain rent and other expenses. I need to study for my MCAT. If I don't take my MCAT on time, it's going to delay things. And I actually had a little bit of a breakdown of just, what do I do? What am I doing? And realizing and just taking a step back and saying, okay, I don't need to take my MCAT at this time. I have a job that I can continue working at when I'm following graduation. And my big goal and job right now is to do well in my classes in order to graduate when I want to. And just being comfortable with that, of taking a break, and like I said earlier too, of being open to those gap years, and just being flexible with that. And my goal was just, I need to graduate or I want to graduate, and everything after that can wait.
I have not been up the hill. It was always a thing to do in college, and I just never did. One of those many regrets, but I guess there's nothing preventing me from going now. My hope with spring upcoming and things getting better with COVID is that we find some sort of new normal. The shift to all virtual was so sudden for everyone, and now it's going to be a gradual process of going back into person. And I think we'll have to find that balance of what works well virtual, what needs to be in person, and being able to merge the two.
For students that are graduating in May, it's scary. Try your best to not be afraid. Don't worry about finding your forever job. It's okay to find a temporary job where you continue to search and work for that job you really want. If you currently have a job from undergrad that you are happy in and you're able to work at for some time, stay there while you continue to build your resume, connect with people, and then start applying for that job. Especially now, it's difficult with a ton of companies, financial struggles. People may not be hiring as much as normal. If you're comfortable, it's okay to be comfortable and take some time to take that leap. If you want to go on to grad school, look into that option. Start studying for those professional school tests. And just, again, find that temporary job to get you to that next step. If that temporary job is not your final step that you want to go at, it's okay to take time and breathe for a little bit.
When entering the workforce, there's a lot that you need to learn, and being able to just take that very entry-level position of just getting some of that experience to then get a higher and entry-level job where you can build connections with coworkers, build those stronger communication skills, figure out how to work as a team, figure out what you like to work as a team or how you act as a team member, and what skills you truly have that you can benefit for other people too.
My advice to undergraduates who are looking for those next steps where you still have a couple of years, take advantage of those fairs. I know they seem scary, especially if they're all there in one place, walking around not sure what to say. Take a friend with you, someone that you can connect with. Bring copies of your resumes. Don't be too intimidated, which is definitely easier said than done. But take advantage of the resources that you have in front of you, because once you graduate, you're going to feel like you don't have those resources anymore. I think LinkedIn would be a great resource for students who want to connect with employers or just to see what's out there, as well as direct contacts. A lot of businesses have emails that you can reach out to and just say, hey, I'm looking to connect with someone in this field. Can you help me out? You may not get it on the right try, but if you send an email, you don't hear anything a week later, follow up. Don't be afraid to pick up that phone and just call to say, hey, I'm looking to get connected with someone to ask some questions about this position or this field. Can you help direct me? I think LinkedIn is a great place to start, as well as just Google search some stuff. I think that would be good too, as well as for students in pre-health, go into a hospital, maybe not right now, but connect with them, see what volunteer services they have. It's all about those chains. If you volunteer with someone, maybe you'll connect with them who have done steps A, B, and C, and you want to connect with step C, and just get that advice from other people.
For graduating students, you can do it. You've already come so far, you just have a little bit longer to go, and you're so close, and you can finish and you can do it.